Yeah, hello, DPS family. My name is Steve Federico, and I'm a pediatrician and the director of general pediatrics at Denver Health. I'm happy to report that our community continues to trend in the right direction relative to the incidence of COVID. We see a high uptake over the past month of vaccinations among parents that fall into the ages of 20 to 40. We're also seeing a decrease in the rate of COVID amongst our adolescent population. That rate had been going up previously, and it coinciding with a broadening of the age range of vaccination from 12 years old and up, we're starting to see rates drop. So that's super exciting, and I'm excited to see that. So good job, DPS, good job, family, good job, Denver, for going out and getting vaccinated. Yeah, it's really, really hard to predict what school's going to look like in August. I'm highly confident that it's going to look a lot better than it does now. Most pediatric experts, most school experts, most infectious disease experts are predicting a school year where many of the mitigation measures that we have in place will no longer be needed. There is a recent report out of the CDC research report that shows the two most important measures have been masking and ventilation. So good airflow or being outside. So what I think we're going to be looking at next school year is a school year where we're still considering masking and where we're encouraging good ventilation inside and encouraging activities to take place outside when possible. I think those are probably what we're looking at. There is likely to be some differences between elementary schools and secondary schools because a vast majority of kids in the secondary schools will be vaccine eligible. And because our community has been so strong in getting out there and getting those adolescent students vaccinated, I believe that we will be in a place where we will be able to do less restrictions for our middle schools and high schools. But some of those restrictions will probably have to still be in place for elementary schools since none of them will be vaccinated likely come August. I think there's no reason to expect the COVID rates in our community to do anything other than continually and steadily decline. That could change if we get a new variant introduced into our community. That could change if our vaccination rates stall. But all trends are moving in the favorable direction. I do think it's important for people who are unvaccinated to continue to mask. But I think it's more important that unvaccinated people work to get vaccinated. And if we continue to do that, we could be in a really fabulous place come August. I think I would take an opportunity to speak directly to our adolescent students, our middle school and high school students, and say, I really applaud those of you who have been in this first wave of vaccination to be motivated to go out, and we worked really hard to create easy access points in the schools, in the clinics, in pharmacies across our community. I think the next step is to have everybody talk to their peers, to have students talk to students about the importance of trying to return back to a normal school year and how the people who are most in control of whether or not that happens are the students themselves. And so I think empowering each other to ask questions about the vaccine if they have questions, and to help each other out in terms of finding access to the vaccine and get it and get vaccinated so that we can return to normal.